Hi there, my name is Ren. I will be teaching you a little bit about heart failure. It is very important to understand first the organ of the heart in order to understand all the conditions and the predisposing issues that may come and affect the heart. You have your four chambers. You have your ventricles and you have your atria. The atria which fills with the blood, the ventricles are the juicers behind, the pumpers behind the heart. When you have issues with pumping blood that is oxygenated, it starts to affect and reflect the rest of the body, the rest of the tissues, the rest of the organs. When it's a ventricular failure, that's when heart failure is necessarily diagnosed. Heart failure is a very serious thing. It can be impacted by several predisposing things. Unfortunately, some of the genetic things that cannot be avoided, but there's definitely treatments. We'll go into that in a later class. In this class, we'll discuss heart failure and its classes. So there's four classes of heart failure. You have your first class, where a patient's lifestyle is going to lead to heart failure and heart conditions. And by that I mean alcoholism, smoking, diabetes, lack of exercise, lifestyle choices that may be changed or altered that can actually prevent to getting to the worsening of the heart issues. Your second class is when a patient starts to develop some symptoms. You have some weakness, some fatigue, but nothing that's going to be overexerting or is going to slow you down. There's definitely some ventricular changes. There's definitely some slowness in the pumping action. So at this point, the doctor is assessing, examining the patient, diagnosing, and also treating. The third class would be the class where it gets a little bit more serious. You have weakness, you have edema, you have fatigue, you're overexerted, short of breath with a little bit of exercise. And your fourth and last grade is the most serious of all, and that is when actual heart transplant, valve transplant is necessary, and other means. At this point, treatment and everything else has to be overexerted, and the doctors have to follow up very carefully. Please let me know if you have any questions.